for stopping in and watching another recording of Meet the Faces of NF Care. I'm Sarah Sologic. I am the Care and Outreach Coordinator here at NF Midwest. And today we are lucky enough, we have Lurie Children's NF Clinic with us. So we're going to go ahead and jump right in. And Dr. Listernick, go ahead and take it from here.
Okay, hi, everyone. Thanks for giving us this opportunity. I'm Dr. Bob Listernick. I'm an academic general pediatrician, and I was one of the co-founders of the NF Clinic at what was then Children's Memorial Hospital in 1985, I believe. And we've been providing NF care for the last 37 years. Maddie?
Yep, and then my name's Maddie Hankins. I'm a genetic counselor, but then also the clinic coordinator.
Great. So let me tell you a little bit about our clinic. We see our full NF clinic is staffed by myself, Maddie, Dr. Carlos Prada, who's not on the call today. Dr. Prada is the head of genetics, and he recently came to Lurie Children's about 2 years ago. Dr. Prada is an NFologist and has really tremendously augmented our clinical and research endeavors. Catherine Kim is our other genetic counselor, and we are in between social workers, but we absolutely have a social worker here. We see patients primarily at a satellite facility in Lincoln Park of Lurie Children's on Clark Street. We're probably one of the only clinics in the country that does what I call one-stop shopping. We offer both seeing the NF team as well as our NF ophthalmologist. Pardon me, I should have introduced Dr. Janice Lasky-Zide, who's been our NF ophthalmologist for many years. And then I neglected to say that we have our newest member who's not come yet, and we're really excited about her presence, is Dr. Miriam Borners, who is a very well-established pediatric neuro-oncologist coming from the Gilbert Neurofibromatosis Center at Children's National, and we're really excited that she's going to be joining us in December. So back to the clinic. The clinic offers one-stop shopping in Lincoln Park, where our kids will get a complete physical examination and an assessment, as well as an ophthalmologic examination when it is needed. Because we've been doing this for so long, the waiting time had gotten way too excessive for my tastes. So we've opened up appointments where I see patients, and they're primarily new patients at the main hospital down in Streeterville, where I'm seeing now a lot of the new referrals for NF care. I can easily see an urgent referral within a week. I can easily see a follow-up of a family who may think they have an urgent problem within a week. So that, despite the long waiting time in Lincoln Park, it's easy to get in to see us if we think if there's an issue that needs immediate addressing. Maddie, you want to say some more things while I look and see what else I want to say?
Sure. So seeing as how we are a children's hospital, we do primarily see children. However, we do see them kind of across their childhood lifespan. So typically we start transitioning young adults around age 22 onto their adult care providers. There are several adult NF specialists throughout the Chicago area that we have close relationships with. So that's who will then refer our patients to once they are kind of at that age. In terms of kind of what might happen at a first appointment, at the full NF clinic, exactly like Dr. Listernick said, you'll get that physical exam and then you'll get an eye exam. based on those evaluations, we'll then kind of have a conversation as to, what do we see? What kind of recommendations do we want to make? And do we want to see you back for another visit? So it's kind of just a brief look into, maybe your first visit. Going back to, kind of transitioning patients out of clinic once they reach adulthood. Another emphasis in our clinic is our transition program. So we've been working really hard to create a program where we're not just, seeing kids until they're 22 and then, kicking them out the door. We're really trying to prepare kids, for that transition, even as early as kind of early teens, talking with children about their diagnosis, at levels that they can understand, and then kind of slowly, as we continue to see them yearly, kind of ramping up our conversations so that they have a better understanding of their diagnosis and can ultimately, at that appropriate age, kind of take on their healthcare, independently, which is again a really big emphasis for us.
Yeah, I'll say that Maddie, Catherine, Kim, and many of you may know Allison Weissman, who was our previous clinic coordinator who's transitioning to a different role here, have put together an incredible document about transitioning. We're in the process of editing it and fine-tuning it, but they've done a tremendous job. And this is something we'll start distributing once we have the final copy of it. As far as the upper limit, I will say that we also will see adults once for both making a diagnosis and for counseling or for family planning purposes. But as Maddie said, I'm a pediatrician, Dr. Prado's a pediatrician, and we really can't assume the longitudinal care of adults. I will also say that in general, we try and transition uncomplicated patients when they graduate college, if they go to college or at the age of 21. But we have a lot of patients that we're keeping for 24, 25 years of age because they do have complications of NF1 or NF2 related schwannomatosis, that they're seeing other subspecialists in our hospital. So we're very malleable about that.
If it's a first-time parent bringing their child into the clinic, what could they expect in terms of what is that day going to look like? How long should they carve out in their day for that appointment?
I will admit it's a long visit. It's a long visit because they're getting an ophthalmology visit as well. And if anybody's gone to the ophthalmologist, that that's a long visit because first they see you, then they put drops in your eye and you wait for the drops to work. And then they look at your eye after the drops dilate your eye. So we've worked it out pretty well, I think. So what generally happens is Dr. Zeid's team sees your child first for the undilated exam. Drops get placed, and then we see the other part of the NF team sees your child and your family, does all the non-eye related NF counseling and such, and then they get the dilated part of the eye exam. So I will admit it's a rather long clinic day. I would say roughly 2 hours worth, but I think it's well worth the one-stop shopping aspect of it.
Absolutely.
Maddie, you have anything you want to add to that?
Yeah, and I think, definitely just logistically, kind of for all the evaluations that are taking place, it takes time. But we also want to be able to give families the opportunity to ask questions. I know for many people, maybe you've been waiting weeks or months for an appointment and you've had questions about your child's health. And, we're always encouraging families to bring those questions. And, we want the opportunity to discuss those with you. So obviously that's going to take some time as well. But, hopefully it's helpful.
One of the questions you have written down here, Sarah, is what does the team believe is their biggest clinic strength?
Yeah.
Well, one, I think we're a great team. Two, as I said, I've been doing this for 37 years. Dr. Prada has been taking care. I don't want to tell you his age, but he's been doing it for a lot less than me, but he is an established NF clinician. And I think, and then, we have superb genetic counselors and a superb clinical coordinator in Maddie. The other thing we didn't talk about is that we are part of the Department of Defense Clinical Trials Consortium. So we have access to the cutting edge treatments. We participate in a wide range of clinical research projects. So people will be on the front line of any clinical trials that we are participating in. So I think those are two big strengths for us.
Yeah. So we sent out a survey and kind of got our members to turn in any kind of questions they may have about clinics, and some of them are general health questions altogether. So if we could take a moment and kind of go through those. What is the view of early regular screening for MRIs, genetic testing? Until what age do they recommend eye screening with dilation? So a couple questions in one. So we'll just start with on a first visit, is there a baseline MRI that is completed?
Well, I guess I'll take that one. So I wouldn't say that's a controversial question, but it's a very reasonable question. For the research that we did in maybe my first 15 to 20 years of NF1 care, my belief is that we don't need to do routine, as you say, Sarah, baseline MRI scans. The reason is that we feel that the most important thing is the eye exam. I don't want to spend a lot of time talking about optic pathway tumors. I'll just say that if I were to do an MRI scan of every child who has NF1 at the time they're diagnosed, we'd find evidence of an optic pathway tumor in 15%. Of that 15%, maybe only half will ever cause symptoms or signs. And of that half, maybe only about 40% will ever require treatment. So, and back in the prehistoric days, NF doctors cared more in some ways about the size of the tumor and tumor growth. We certainly care about that, but we care much more about the vision exam and your vision. So I would say that I think it's fair to say that the good majority of NF1 clinics do not do routine MRI screening. But that's not to say it's wrong. That's just my opinion. And there are some very good NF1 clinics that do baseline MRI exams. I can wax poetic about this forever, but I don't think you need all that information.
Okay. What about the next part of that question was genetic testing? Is that a routine test? And what would warrant a genetic testing?
At this point, it still is not necessarily a routine test. I think it is still a very helpful tool that we can have in our back pockets, and that we may recommend kind of based on a couple of different scenarios. So maybe a child meets clinical criteria for NF1 and, family is just interested in further confirmation via genetic testing. Maybe a child doesn't meet clinical criteria, and family again, wants to look for an additional criteria that can be met via genetic testing. So I think there's a lot of different scenarios that could warrant genetic testing. And really that, the conversation as to whether or not we pursue genetic testing will be based on your child's exam. So that, can be another thing that can add to the length of the appointment. But, it still is, I think, a really important conversation to have.
I'll add a couple of things to that, Sarah, just to augment what Maddie says. First, we might do genetic testing. Well, as I tell families all the time when they ask about this, compared to some diseases where there's only a single mutation that gives the exact same disease to every child, in NF1, there are probably over 1,000 different mutations. And of that over 1,000, maybe only 6 or 7 can predict anything about your child's future. The most easily recognizable ones are kids who have whole deletions of the NF1 gene and genes surrounding the NF1 gene. And those tend to have a bigger risk for neurofibromas, a bigger risk for cancer, and maybe a bigger risk for intellectual disability. So if we suspect that, we will certainly do testing. Then there are scenarios where the child is 11, 12, 13, just has some cafe au lait spots, nothing else. And there are a couple of pathogenic variants where kids just get spots, freckling, Lisch nodules, the little bumps in the iris, and nothing else. And that can be helpful to families as well. And then I'd say finally, for some of our upcoming research studies, we will need confirmatory genetic testing. But still, as Maddie said, for the vast majority of kids, it really doesn't change anything.
And to what age, the third part of that question, and to what age do they recommend the routine eye screening with the dilation?
Well, that's a good question. The reason we're doing the eye screening primarily is to look for evidence of an optic pathway glioma. And though the highest risk period for that is in the first 10 years of life. So I think it's most NFologists' belief that every child with NF1 should have an eye exam once a year up until around the age of 10, and then they can be spaced out. The other reason to do an eye exam at any age is if you're looking for Lisch nodules, because you're looking for another criterion to make the diagnosis of NF1. But the big reason is to do it most important thing is to do it in the first 10 years of life, looking for evidence of a tumor.
Thank you. And our second question is, what is the recommended frequency of follow-up visits for kids under 18 with little to no major complications or concerns?
General recommendation is that every child with NF1 should be seen at least yearly. So certainly if a child has more complications, there may be specialists that they'll need to be seeing, in between those yearly visits. But for kiddos who maybe are a little bit less complicated, yearly is generally what we are going to recommend.
And as I said earlier, if there is an issue, can easily be seen here within a week if there's an NF related issue.
Yeah, definitely don't wait until that year to bring up an issue that came up 6 months ago. If something comes up in the meantime, let us know, and then we can kind of figure out whether or not we need to see somebody in or not.
Yeah. And I'm sure, and so is this once yearly, this is also, you still recommend they stick with their primary physician or pediatrician as well?
I'm happy to get questions. I'm happy to get my chart. I joke that I'm old and I'm a 2-finger typist. So if somebody my charts me, I will probably call them back. But in general, I would like people to go through their primary care physician first. But if it's clear to them that it's an NF related problem, I'll answer the question.
Perfect. And that fed into that third question. Is the question was about when do they know when to go to their primary and when it probably is something NF related?
I can't really answer that question. If their concern is NF related, feel free to call. For instance, during COVID, both of us must have gotten hundreds of calls about, is it okay to get the vaccine? And of course, it is okay to get the vaccine. And I don't mind getting those calls. But if a kid has a fever and a snotty nose, I think it's better to talk to your PCP rather than to me.
Yeah. Thank you. The next question, is there anyone on staff to help if any kind of insurance issues come up? I did note that you have a social worker on staff. Would that be who they would speak to kind of navigate some of those issues?
Yeah, so I would always say start with me, and then I can kind of funnel anybody off into the appropriate place. If it's an insurance issue as it relates to genetic testing, that would be my area. If it's an insurance issue as related to kind of care, I kind of know the right people to direct you to, whether or not that's social work or or if it's one of our admins. So yeah, definitely lots of help in that area. We run into a lot of things, so we have a lot of good experience, unfortunately, dealing with those areas.
Perfect. That's great. I think sometimes people just like to know that someone has their back on those situations, or sometimes people just don't even know where to start, or
Yeah.
that a simple form to their insurance company can completely make the difference between a approval or denial on a test. So
Sure.
Amazed that I struggle with myself. But I've now had experience in these different areas that for a lot of things that come up, I unfortunately, but fortunately have seen them before. So more than happy to help.
yeah. Our next question is, who should a parent take their child to if they believe that they have a behavioral issue due to the NF?
So that's a tough question, because there's certainly an overlap to be what behavioral issues are for NF and behavioral issues for just for children. And frankly, I think I would always start with the pediatrician. To be honest, so we have, I don't know how many active patients, over 1,000. And if you say the current estimates that are 60% of children with NF1 may have learning disabilities, ADHD, or both. We can't handle all that. So I really would start with the pediatrician, and for both behavioral counseling, for ADHD management. We're happy to provide information to the school, happy to provide information to the parents. We often tell parents about the Vanderbilt scoring sheets for diagnosing ADHD. I just don't have the bandwidth to manage ADHD. We provide the school and the teachers with educational materials and information regarding NF1 and ADHD, but frankly, the management is the same. As far as more kids who are on the autism spectrum, let's say, and they're looking for behavioral help, that's a tough one, because we all know that there's a dearth of psychiatric and services out there. So we struggle with that as well as everybody else struggles with that. I don't have any better words of wisdom for you, but other than that.
No, I think that was great. All right, so our next one is, are there any lifestyle changes or strategies that can help manage a glioma in NF patients?
Specifically a glioma?
Yeah.
That's the question. Well, no. The only thing I would say is strongly, because many kids who have gliomas don't have visual problems, but if they do, they should all be on a 504 plan with their school, which entitles them to educational modifications based on their visual problems. Other than lifestyle or homeopathic medicines, if that's what you're referring to, no, I don't think, treat a kid normally.
Thank you. And our last question, and we'll just touch really briefly, because I'm sure this could be a much longer video. This is, can you explain the difference between gliomas and how they relate to NF?
Okay, so when we're talking about brain tumors in NF1, the most common type of tumor is an optic. I'm calling it an optic pathway tumor. People might refer to it as an optic nerve glioma. A glioma is a benign brain tumor. Benign means it's not cancer. It doesn't spread to other parts of the brain. If it's going to cause problems, it causes problems locally because of what it does to the optic pathway to your vision, but it won't go to other parts of your brain. That's a benign tumor. Gliomas in NF1 are somewhat different than gliomas in children who don't have NF1. For the most part, in children who do not have NF1, gliomas inexorably grow. In children who have NF1, the two most common locations in the optic pathway and in the back part of the brain, often we find these gliomas and they just sit there and do nothing. So it's very different than what parents might hear about a brain tumor in a child with NF1. It is not, I mean, of course, it's a very significant complication, but it's not the devastating complication that lay people think when they hear the term brain tumor. At least that, from a doctor's point of view, that's the way I think about it. Obviously, from a parent's point of view, it's a horrible complication.
Yeah. Thank you so much for summing that up. That's the end of our member questions, though. If you have anything else you'd like to add about your clinic?
Maddie, come one, come all. We're happy
Yes.
we're happy to take care of anybody. We did not touch on NF2 related schwannomatosis. I don't know if that was something you planned on not talking about. I'll just say that we have all the capabilities here. We're seeing younger and younger children with the diagnosis of NF2 related schwannomatosis as referring physicians get more and more savvy. And we certainly have the expertise within our hospital to take care of these children.
And the only thing I would add as well, I know Dr. Listenik already talked about how we're doing a wide variety of different research projects. So definitely if families are interested in getting involved in research, encourage you to reach out and, talk with us about any of the ongoing studies that we have going on. We'd be happy to discuss with anybody whether or not your child meets criteria or whether or not it would maybe be a benefit to you.
Perfect. Thank you so much. I always love these because I always walk away knowing so much more than I knew before we started. So I hope everyone watching feels the same way. So thank you everyone for watching another one of our recordings of Meet the Faces of NF Care. For information about NF Midwest or Lurie's Children's NF clinic, information will be at the end of the video. So thank you so much. See you next time.
Thank you, Sarah.